Part 4 of our training series will cover the basic principle of patient enrollment. Before you enroll a patient in ERKReg, a few key inclusion criteria must be considered. First, there must be a confirmed rare kidney disease diagnosis. Only diagnoses that are mapped to a valid author code can be entered into the registry. The author code catalog should therefore always be checked to ensure correct classification. Please find the catalog in our Useful Documents section. Second, the patient must have an established renal diagnosis. Patients with an uncertain, suspect, or pending diagnostic result should not be enrolled until the diagnosis has been clearly confirmed. Third, informed consent is mandatory. Patients must have provided a signed ERKReg informed consent form or an approved equivalent informed consent form prior to the enrollment. Fourth, the patient must be managed by an ERKReg center, meaning they are under the care of an ERKReg participating healthcare provider. Finally, there must be a minimum required patient information available, and it should be possible to ensure longitudinal follow-up, allowing the patient's clinical course to be documented over time. The ERKReg informed consent, which you can find in the section Useful Documents, includes several distinct consent options that patients can choose individually. Each of these must be correctly documented in ERKReg. As soon as a patient signs the informed consent, they give consent to include coded data to one or more ERN databases or registries. Second, they may agree to being contacted for research projects or clinical trials, enabling potential participation in future studies. Third, patients can give consent for pseudonymized data to be shared with commercial partners where their aim is to improve healthcare and related services. Fourth, they may also consent to pseudonymized data being shared with researchers outside the European Union supporting international collaborations. All these consent options are documented separately within ERKReg and must be accurately transferred into the entry section. They are essential as they determine which data can be used in future analysis and research projects. To enroll a patient into ERKReg and to see the whole list of all patients that have been entered into ERKReg by your center, please click on Data Entry at the dashboard. This is an overview of all rare kidney disease patients entered into ERKReg by your center. To support easy navigation, several filter options are available, allowing you to quickly search and organize your patient list. To start a new patient record, click on Add a new patient. The red cross icon allows you to delete a patient entry. This should only be used in case of an entry mistake or if a patient withdraws consent. Each patient is assigned to a unique patient ID, which we call ERKReg ID, and this is automatically generated by the system once the basic information has been successfully saved. The first 3 digits of the ID correspond to your center ID and are therefore identical for all patients from your center. You can also view the main patient information in the glance. This includes the treating unit, the sex, the date of birth, the disease group linked to the corresponding diagnosis, and the section also indicates whether the patient is eligible or enrolled in a sub-registry. In addition, the list shows the patient's current CKD status and the treatment modalities such as dialysis and transplantation. Finally, a color-coded alert system helps you to manage follow-up visits. Red indicates that no initial visit has been entered or that a visit is already overdue. Yellow means that the next visit is due soon. And green shows that the patient data is up to date and everything is good. As mentioned before, the ERKReg patient ID is automatically generated by the system once the patient record has been successfully saved. For your own internal documentation, it is recommended to create a separate Excel file to oversee your ERKReg enrolled patients. This file should include the patient's name, the surname, date of birth, date of informed consent, and the ERKReg patient ID. This document should be kept securely and accessible for you and your colleagues only who are working with ERKReg. This list ensures that you are enabled to re-identify your patients at a later stage if needed. The next part of the training series will show you how to enter new patients step by step.